for people who are unfamiliar with the term rhinitis, can you define that for us non-doctory types?
Well, that's where you get runny nose, postnasal drip, nasal congestion. And if it involves your eyes, it's called a rhinoconjunctivitis. So it involves your eyes. You can get tearing of the eyes, itchy eyes, and so forth. Now, we talked about allergic and non-allergic rhinitis. So allergic rhinitis is where you have a frank allergen in the environment, usually that triggers a headache. So we talked about pollen, for example. So your headaches worsen you get basically nasal congestion, runny nose, you feel congested, you feel crappy. I mean, even you feel tired during these allergy seasons as well. Then there's another type of rhinitis called non-allergic rhinitis. And those people have non-allergic triggers. So those are things like cigarette smoke, perfumes, which is a common migraine trigger, by the way, other smells as well. And these are not creating an allergic response in the nose, but they're still activating nerve cells that go in this. The trigeminal nerve goes to the sinuses and to the nose. So basically, it's probably directly activating those chemicals are directly activating things, and even things like air pollution, which is also very common in the environment. So all these things can cause allergic and non-allergic rhinitis. We found that both allergic and non-allergic were associated with migraine.
That ties into our next question very well, which is what is happening physiologically in the body that makes us more vulnerable to migraine when our allergies or sinuses are flaring up? You mentioned the trigeminal nerve. Is that one of the main culprits working here?
Well, the trigeminal nerve is basically, there's three divisions. There's one division, one part of it that goes to the forehead, one part that goes to the cheekbones, and one part that goes to the jaw. So it's kind of like this. It's the main sensory nerve of the head. And during a migraine attack, this nerve becomes activated. So there's mast cells. So there's cells called mast cells that surround the trigeminal nerve, both in the nose, in the sinuses, and even up in the lining of the brain, which we think is a very important place where headaches generate. There are these mast cells. So when you get exposed to an allergen, a pollen or mold or something like that you might be allergic to, it activates all these mast cells in your body, and it secretes chemicals that then can activate the trigeminal nerve and cause it to activate and secrete the chemicals that produce a migraine. That's kind of a simplistic way of describing it.
I'm just trying to follow all of our trains of thought. An antihistamine can help treat rhinitis or an allergy attack. And having your allergies be more under control could possibly reduce migraine attacks?
Right now it's just an association. We know that allergic rhinitis or hay fever is associated with migraine. We don't have great data on treatment of allergies or allergic rhinitis or hay fever in terms of preventing migraine. But there was one study that looked at a nasal steroid called fluticasone, where there's a nasal spray where they took a couple sprays twice a day, and those people were having facial pressure. So this is just pressure, and they found that the nasal steroid could actually reduce the severity of facial pressure as well. So I'm pretty certain that probably, these allergies, in a migraine patient are probably triggering headaches in some people. And the other thing you need to know is there can be structural abnormalities of the nose and sinuses. So if you've got a deviated septum and you get allergic rhinitis, then there's going to be contact points between that nasal septum and the wall of the nose. And that could theoretically activate migraines as well. So there's lots of factors. You could have allergies and migraine, and then you could have, anatomic abnormalities of your nose and sinuses that might predispose you to have more frequent migraines.
Do we know the comorbidity between allergy and migraine, or is that data just not out there?
No, there's definitely a comorbidity. We showed it in two separate studies. As I said before, namely that migraine is more frequent in those with hay fever, and more frequent and if they have migraine, the headaches are more frequent and more disabling in those that have rhinitis. So it's probably At minimum, it's probably a risk factor for more severe disease.